Okay, so today I'm going to show you how we're going to perform a blood glucose test. So firstly, we would gather all the supplies that we need to perform the test. And over here we have the glucometer. So we just want to make sure that it's working fine. And we have the test strip here. We want to make sure that it hasn't passed its expiration date. It says November 2022, so that's good. And this is the fluoride oxalate tube, which has our blood sample that we'll be using to measure the blood glucose level. And this is the syringe that we'll be using to draw up the blood sample. Okay, here we have a pre-collected blood sample in this fluoride oxalate tube. So the fluoride oxalate tube is used solely for testing glucose levels. Fluoride has been added to inhibit the enzymes that are present in the blood, thus preventing the degradation of glucose levels. And the oxalate acts as an anticoagulant in this sample. Okay, so now I'm going to draw up the blood sample. So this blood sample has been inverted about 10 times. And just draw a little bit of blood. And now I'm going to turn on the glucometer by inserting a test strip into it. So I want to make sure that I do not touch the metallic bit, which is at the top here. And I want the butterfly to be facing upwards as I insert it into the glucometer. So because we are using the blood sample collected from a dog, we would be using the code 35. If it's a cat, we would be using the code 37. So we set the glucometer to code 35. And now we place a small drop of blood at one side of the test strip to get the measurements. So it says error 1 on the glucometer because we have used the old blood sample. So once we get the blood glucose measurement, we want to dispose of the test strip and anything that has come in contact with the blood sample. So we take this out and we throw these into the clinical waste bin.